Today we are doing tear trough filler. So we are going to be using a hyaluronic acid filler to give some volume under our patient's eyes. Because as we get older, our skeleton changes, our fat pads move, and sometimes we can get dark circles or we can just have a hollowness that we don't care for. So what do? We're going to replace the volume. So I've already done a little bit of lidocaine right here so that you can see that little white spot. Can you feel here?
No.
All right, so this is going to be our little entryway, and we're going to use some hyaluronic acid filler. So I'm going to go in through my little spot here and open your eyes and look up for me. Perfect. And there you go, deep. We're going to just put a little bit of volume in there. So there are many different types of hyaluronic acid fillers. You have to just put a soft one here because you wouldn't put a cheek filler into an area that needs a real soft filler. So that's why we're currently using something called Volbella for this area. And it's a Juvederm filler. You could also use Ultra, Bellatero. There's all sorts of, there's Restylane ones you can use up here as well. So there's all sorts of different ones. There's not one that you don't need to know what filler you need. You just want to tell your injector, this is what I want you to do. And then they can figure out the filler for that particular spot. All right, you doing okay?
Mm-hmm.
So the Juvederm family, it's all the same category, I want to say, of fillers, the same grouping of fillers, but they all have a different purpose and a different location where they should be, where they can be used. So you can see how that filler just plumped her up right away. So a filler is great because it works, like I said, right away. So we may come back to this spot in a minute. We're gonna let that just settle down and we're gonna go to the other side here. And I like using the cannula because it's a lot less risk of bruising and a lot less risk of complications. And I always have to kind of hold my breath for people, and they have a nice big vein right there if I was doing a needle, but I don't need to really hold my breath for doing it with the cannula because it's a blunt tip. So even if I run into that vessel, it should not cause it to bleed. And I was saying off camera that I always like to do just one syringe of filler between the two eyes each, like in one session. I don't like to do too many syringes at one time. It's generally a want, and so you should take the time and go slow in doing procedures like this. You want to get it right. You don't want to look kooky. So that's our mantra is we won't duck you up when we talk about lips, but we also don't want you to look funky up here either or anywhere. You're doing awesome. And so really, I mean, that looks great where we're at. So might put a little bit more lateral over there. Which side do you sleep on?
Both. I'm just rolling around constantly at night.
Rolling.
Mm-hmm.
I wish I could sleep on my back. That would be optimal.
That's about where I end up when I give up on
all the positions?
Yeah.
Well, that's a good place to end up. But I wish I could just stay there.
Mm-hmm.
See, it's really moldable and nice. Bring your chin down for me now and look up. And this is the beauty of having the cannula because you can go back and forth and back and forth. I don't have to poke her again. I'm just going to go through my little port of entry, my little channel. And you can see my cannula right there. A little bit, right like that. There we go. And I used to do this with the needle, but it's a little nerve-wracking when there's a great big artery and vein right here and you have a needle going down to bone. But some people like to do it that way. And you know what? To you injectors that do it that way, more power to you. I like the cannula. This does have some lidocaine in it, so your eye might feel a little twitchy for, I don't know, 5 seconds, then it goes away. And the filler can last you for a whole year. or even a little bit more. You know, we don't generally use, this isn't like our mouth where we use a lot. You know, you don't generally work this filler that much. So it can last you for a year or more up in the tear troughs. Let's see. That looks good. All right, I think we're done. So good job.
Okay.
And these little areas are going to heal up and they're going to go back to normal color, and she's not going to bruise, and she can go out and look fabulous like she does right now.